There we go.
All right, let me change my name.
Okay.
How are you?
Okay. Recovering from a cold from the grandkid. It's
Oh
perpetual.
no,
It's always. I told him just send me Kleenexes with the germs so I can get over it before I get there.
that's right.
Okay, let's see what we've got here. Um, I'm going to go ahead and okay, you're the host. You want to go ahead and make me co-host?
If I can figure that out. Yes.
Be in the just the right the three dots on the right up on the upper right hand
Um,
side of your skin of your screen.
I've got three dots that say more.
Try that.
That's not it. Host tools,
Yeah, host tools maybe.
participants, and church more. Make co-host. Or
There you
should I
go.
make you the host?
Yeah, make me host to make sure I can then let
Okay.
people. Okay, that's great.
Okay.
And I can make you co-host. There we go. Okay, I'm gonna make you host, co-host. There we go. Okay, confirm. There we go. Um,
We
I
don't
think.
use Zoom anymore, sorry.
Let's see. The waiting room is. They keep on moving this waiting room thing around. It drives me nuts. More host tools
I
for.
can I
There
can
we
admit them if you want.
go. It should be under host tools for participants.
Do you want
Hmm.
me to admit them? Because I could do that right now.
What's that?
I can admit them if you want me to.
No, let's wait just a minute.
Okay.
Let me
Let
go
me
ahead
turn
and see if
around.
I can't find. It usually has them.
Like in the background. At least this is a little less busy.
Hmm. I'm not seeing the. I've got to go back into Zoom and find out where the remove waiting room is. It used to be under the participants. Hold on. Chat, rename, unmute, start video, cloud recording, transcribe my notes. No. Um, oh, there it is right there. Okay. I can just open the waiting room in a few minutes and then I'll go ahead and just share my screen. Let me see where I am.
Okay.
Um, here we go. Let me open that. I've knocked it down a few slides so that, all right. All right, so I'm going to disable, what the problem is once I have the share screen going, it doesn't allow me to muck with the waiting room. So I'm
Mhm.
going to go ahead and disable the waiting room so people can enter automatically. And then if
Okay.
you see people in the waiting room still, would you go ahead and admit them?
Yep.
Because I'm going to share my screen now.
Okay.
Mm, there we go. All right, are we seeing the share screen now?
Yes.
Okay, let me get back the one that I'm looking for. That's the one I want. Okay. Well, come on. Oh, there you are. Ha ha. I just have to grab you. There. All right. You still think you have a good share screen there?
Yep.
Great. Wonderful. We're in good shape.
Mhm. So there are still 4 people in the waiting room. Want me to admit them?
Yeah, please. Go ahead.
Okay.
They shouldn't, it should automatically allow them in now at this point, but it's
Yeah,
possible. Everything is possible in Zoom, what I've learned.
that's right.
So you're having a great day, huh?
It's fine. It's just surprises at the last minute always, right?
Yeah, I know. It's been great. So, hey, give me an updated photo with your new puppy.
Oh, I will. I don't know that I have any right now, but I'll start looking.
Okay. You don't have new photos with your new puppy?
I have a lot of photos of the puppy. Whether I have photos with me in them, I'm not sure.
Okay, great. Hey, good morning, everybody. I'm Ann Church. I'm with Villages of Santa Fe, and Katie Titus is with CHRISTUS St. Vincent's Rehabilitation Services. And we're excited to bring our program here today. We're going to leave the waiting room open and let more people enter, and we'll get started promptly at noon Mountain Time. In the meanwhile, Katie and I get to catch up. We haven't seen each other in a while, but just to let everybody know, September 17th this year is our falls free checkup at CHRISTUS St. Vincent's Hospital. Katie is the instigator behind all of that and puts together the whole program. It is a in-person program at the hospital, and it is ready. It is to bring you all the wonderful tools that we have to assess your risk of falling, give you more information about falls and how to prevent falls. We'll have tables there from various entities such as Connect Santa Fe, Aging and Long-Term Services. Pardon me, but I am getting over a cold. And we'd love to see you again. That is Thursday, September 17th from 9 to 1 a.m. It's free. Just drop in.
And that's 9 a.m. to 1 p.m. Please don't stay till after midnight. We won't be
Oh,
there.
I guess it's the benefit of having a Zoom call where I can't spread my germs to anybody, right? Ah,
Brings us back to the good old days of COVID, huh?
really?
No.
Whoa. I know I carry a COVID test with me, but I was like, I don't really have anything but a head cold, so.
Mhm.
Mm. But I hated when I was flying back, I was masking up just so the people next to me weren't so nervous.
Right.
So let's get started. So let's see, we have something in the chat. Oh, hello from Charlotte. Good morning or good afternoon, whatever, mid-morning. I'm Ann Church. I'm with Villages of Santa Fe. I'm also the chair of the New Mexico Adult Falls Prevention Coalition here in New Mexico. We're very excited because our big goal is to prevent falls in older adults. And with us today is Katie Titus from CHRISTUS St. Vincent's, who we're
Hi,
really glad
everybody.
today. So we'll be rocking along with our slideshow. If you have any questions, please feel free to put them in the chat. We'll also have a Q&A at the end of the program, and we welcome your input and love to hear from you. So this is part of our series called Conversations That Matter. Villages provides age-appropriate live, online, and in-person exercise programs focusing on balance, strength, and flexibility And these are all very critical for fall prevention. This workshop, we have very specific goals here to let you know that falling is a vicious cycle. There are myths about falling, falling statistics, bad habits that increase your chance of falling, what causes falls, and what is your risk of falling. Katie, if you could take over a couple of slides for me.
No problem. Okay. So again, I'm Katie Titus. I'm the clinical supervisor for the physical therapists in our inpatient rehab facility here at CHRISTUS St. Vincent Hospital in Santa Fe, New Mexico. So we work with a ton of patients who have fallen, and obviously our goal is to not see those patients in that capacity. So that's why I've been a part of this series. So we're going to talk more about how exercise impacts your risk for falls, how important it is, ways that you can be active, including working on your endurance, your strength, your flexibility, and your balance. Barriers to exercise, we all have them, including me as a physical therapist, and certainly my patients that I see. We're going to talk about safety tips related to both home safety and exercise safety, how medication, vision, hearing, and nutrition can contribute to your risk for falling, and we'll talk about some home safety gadgets for better living. Okay, so when we talk about the impact of falls on quality of life, we know that falling carries a heavy burden with or without an injury. Older adults may fear falling and as a result limit their activities and social engagement. That's part of that vicious cycle. And of patients who are hospitalized for a fall-related injury, 35% of them will be readmitted for a fall-related injury and 5% will die within a month. So falling increases your risk of falling. It increases your fear of falling. It decreases your activity. Decreased activity leads to decreased strength, worse balance, less walking, less flexibility. So you're doing less, you're decreasing your functional ability, you're leaving the house less, and you're more likely to fall. So according to the US Center for Disease Control and Prevention, the CDC, more than 1 out of 4 Americans age 65 plus falls annually, so more than 25% of older adults. And it's also the leading cause of fatal and non-fatal injury among older adults. I'm happy to keep going if you need me to, Anne. What do you think? You're on mute still.
There we go. So
Okay.
myths. What are the myths of falling? Falling only happens to other people, not me. Well, I've fallen. Every time I go to my doctor, they ask me if I've fallen, and that's as it should be. They should be in part of that communication with you. Falling is something normal that happens as you get older. Yes, older people do fall, but there are ways to not only reduce the number of falls, but the injury from falls. If I limit my activity, I won't fall, but that's not true because the majority of falls actually happen in your home. Exercise won't help. As long as I stay at home, I can avoid falling. Muscle strength and flexibility can't be regained. Both of those are big myths. And according to the CDC, exercise that improves balance, strength, and the legs lower the chance of falling, making strength and balance training one of the most effective ways to prevent falls. Medication, that's one of the ones in vision we don't really think about when we talk about falls, but taking medication, the myth is taking medication doesn't increase my risk of falling, and we'll talk more about that later. I don't need to get my vision checked every year. You do. It's very, very important. We'll talk about that as well. Another myth, using a cane or walker makes me more independent. Many of you may know or may not know, it doesn't really matter. I had a full hip replacement in October of last year, and I was on crutches from May until after my surgery. But my mantra during that whole time was, I will not fall. So I used my crutches or my walker no matter what, because I knew that a fall at that point would make my recovery that's much more difficult. Another one The importance of communication. I don't need to talk to my family members or my healthcare provider. I don't want to alarm them, and I want to keep my independence. We're going to explore that. When we first started working with fall prevention in 2017, communication was not high on the list, but it is now, and we'll talk about that later. And again, more than 1 out of 4 Americans aged 65 plus fall annually, and they're the leading cause of fatal and non-fatal injuries among older adults. We talk about communication, and the reason being is that fall prevention is a team sport, what we call a team sport. But you have to start with yourself. As we age, our goal is to age in place, to not move into assisted living, to be independent. But that may require you to really understand what matters to you most, because there may be some points that you have to give up on, some points you're flexible on, and some points that you're very adamant about. So clarify what matters to you most, your goals, your values, and your priorities. These change as you get older. Recognize your needs early, whether physical, emotional, or practical, and learn to express yourself effectively so you can advocate for the care and support you want. Make thoughtful decisions about your health, independence, and quality of life. I mean, good communication is really about staying in tune with who you are and how you want to live. Communication with your family is very, very important. If they don't know what your wishes are, then they're going to make decisions and have thoughts that may not be in alignment with yours. So share your wishes about healthcare, daily living, and long-term planning, and make sure they understand your preferences, especially for medical decisions or emergencies. Talk to them about your advanced medical directive, what you would like to see in that. If you think you might have upcoming procedures, let them know how you're handling it, who's going to be helping you, where they can assist you. To build that trust and reduce uncertainty so they feel confident in supporting you and not feel like they're imposing upon you. So that, oh, I didn't mean to think, I didn't want you to think I didn't think you're competent, but if you need for me to go grocery shopping, I'd be happy to do that. Strengthen relationships by involving them in your journey. One of the best ways to start is just ask your families and friends to help check and rid your home of false hazards. Families do best when they know what you want and feel included in that conversation. Katie, take over the doctor if you would, please.
Got you. Okay, so when we're talking about communication with your healthcare providers, I know I've been to the doctor plenty of times where I had a list in my mind of things that I wanted to bring up, and I get there and I forget it all. So, part of it is really taking physical notes rather than mental notes. Another part of it is being honest. So you've got your list and you're going to be honest when you're talking about your symptoms, your concerns, any changes in your health. Bring in your medications or a list of medications with you, and be honest about how those medications affect you. Every medication and every drug interaction affects people differently. So unless you speak up, they're not going to know. Ooh, light just turned off in my room. There we go. Preparing for your appointments. Again, don't just think about things that you want to discuss, but write them down. And then you're going to be working with your doctor to come up with solutions, not just reporting problems. So when something isn't clear, make sure that you speak up so that you can make informed decisions and you understand what your doctor is telling you.
So national statistics. This is where reason why we talk about this is because falls not only are vastly disruptive of our lives, but they consume a tremendous amount of our resources monetarily. So 50 billion is spent on medical costs, just hard costs each year and falls are the most common cause of older adult traumatic brain injuries, accounting for over 46 of fatal falls. So the fall that you think about breaking your hip is important, but the fall where you hit your head and you get a traumatic brain injury and it's not resolved, that can be very, very critical. Since we are in New Mexico, I know a number of you are from other states, but New Mexico has a higher death rate from falls, significantly about 12% higher than the national rates. Our Department of Health does not give us a straight answer about that, but we could easily see that we are a very rural state. There are many counties that have no access to health care without going to maybe 1 to 3 hours away. And that can really affect the outcomes. We are getting better, as you can see. Um, our rate of hospitalization is going up, but that'll help us with reducing the number of falls.
Okay, so I'm going to talk about how our balance system works and how that relates to your screening your risk for fall. So our balance system is comprised of three parts: vision, proprioception. That word means your awareness of what position your body is in and how your body is moving. So whether you are walking on uneven ground and need to pick up your foot more, for instance, that's a good example. And that has to do with nerves primarily in your legs, especially. And then your vestibular system relates to changes in acceleration and rotation. So that relates between your inner ear and your brain. So any problem with any one of those three systems means you're not getting good information about where you are in space, and your reaction to losing your balance is probably going to be delayed. So when we talk about actions that you can take that have an impact on your risk for falls, frequently there's a behavioral component and there's a body component. So the behavioral component are the things that we do day to day that make us more likely to fall. So what we want to do is sort of identify those personal patterns that put you at an increased risk for falls, choose the ones that are riskiest, and implement simple solutions to avoid potentially dangerous situations. So I don't know if we have another slide on this, Anne. Yeah, here are some great examples. So not moving. We know that if you are getting weaker, if you're becoming more sedentary, your ability to react to a loss of balance is going to be impaired. So you're more likely to fall and not catch yourself. Wearing unsafe footwear. This is a big one. We love sandals in New Mexico. I'm sure there are plenty of other warm states that love their sandals, but I can't tell you how many times someone slipped or the sandal came off their foot or, sandal got caught. So wearing unsafe footwear is a big one. Taking medications without knowing the side effects. Living with home hazards. That's a big one. Cords in the way, loose rugs that you trip over. Not installing grab bars when you need them, not having railings on your stairs. Those are all examples of home hazards. Ignoring vision or hearing changes. And sometimes it's not even ignoring. It's like you might not even realize they're happening. If you don't get an eye and a hearing exam every year, you might not even realize your vision or your hearing are getting worse. Rushing. Oh my gosh, is that a big one? I'd say 90% of the patients that I see who have had a fall were rushing when they fell. The doorbell rang. I was in a hurry because I was running late. So many reasons that people are moving too quickly and not giving themselves enough time to move safely and react to a loss of balance. Drinking alcohol. Obviously, alcohol is going to impair your vestibular system, so you are going to feel a little more off balance, probably. Getting up at night without proper lighting. We rely on vision more than any other of those three systems. So if we can't see, we are more likely to lose our balance and more likely to trip over things. Not addressing fear of falling, not being proactive about realizing that you're worried to move or you're not confident about your balance. And doing household tasks that require overreaching, climbing on step stools, picking things up awkwardly from the ground, etc. So how do medications affect fall risk? So a lot of drugs have side effects that include dizziness or lightheadedness, drowsiness, slow reaction time, confusion, blurred vision, changes in your blood pressure. So that's a big one. So that's called orthostatic hypotension, and it means your blood pressure is dropping when you are horizontal and you go to vertical, whether it's lying to sitting, lying to standing, and that can cause you to faint. So if you've ever blacked out or passed out when you got up quickly, that could be what's happening. And it could be a side effect of a medication, especially blood pressure medications. Other side effects of blood pressure medications include low energy or fatigue, headache, nausea, diarrhea or constipation, skin rash, plenty of side effects to all medications. So no risk factor for falls is as potentially preventable or reversible as medication use. So it's so important that you tell your doctor all the medications you're taking, including your supplements. So that's a pharmacist, also an option, but most of you are probably seeing your doctor for longer periods of time than your pharmacist. But if you're getting prescribed a new medication, they will always ask you, do you have any questions? So that's a good opportunity to say, I've been on this for a little while and I'm feeling this way. Is that something I should talk to my doctor about? Or do you know of any interactions with this other drug that I'm taking? That's a good
And
opportunity
also
to
at
ask.
our September 17th event, we'll have pharmacology there. You can bring in
Mhm.
your list of medication and talk to them about it and get a review. I mean, you're right. It's very hard to find time with a pharmacist. I've actually switched my pharmacy over to the outpatient pharmacy at the hospital because there's always a pharmacist to talk to there,
Mhm.
unlike Walgreens or CVS. So it's been very helpful for me to go in and say, I just got an increase in my statins, or what do you think? Do you think and I'm having some leg pain. What do you think? So it's great to be able to have that communication with them.
Mhm. All right, eye exam. So again, I just said vision is the most important system that tells us where we are in space. So getting an annual eye exam is super important, especially if you're having any trouble seeing steps, curbs, or obstacles. If you find yourself tripping over things, that could also potentially be a proprioception problem. Unfortunately, there's not a whole lot that can be done about a proprioception problem other than being more cautious with your vision. So really looking around as you're changing surfaces when you're walking. So also if you're like noticing that your depth perception is a little off, or you're having more difficulty with contrast, seeing the edge of steps or the edge of floor changes, or you're having difficulty in low light or with glare, all of those things lead to more unstable walking because you are being more cautious. So it's so important to make sure that your vision is as good as it can be to help see those obstacles potentially before you trip.
Oh, and I wanted to remind everybody, we will have this recording up on our site probably by tomorrow afternoon. And it's in the chat there. It's villagesofsantafe.org. It'll be first in the blog. So if you want to review this or share with anybody, you can.
All right, so here's a sense that we don't consider one of our three main balance senses, hearing, but there's more research coming out that people with hearing loss tend to have more falls. So it's not necessarily that the hearing loss is leading to falls, but there is a correlation, especially in older adults. So one thing I think that's really contributing is that it's just harder to know your surroundings when you can't hear as well. I also notice people who are harder of hearing tend to turn their head more quickly because they're trying to see the thing they think they hear that they can't localize. And that turning your head is triggering your, sorry, lights again, vestibular system. So if you are, spinning your head quickly and then feeling off balance, that's a problem. So making sure your hearing is as good as it can be to detect your surroundings, to be able to certainly hear, traffic if you're crossing a street, all of those important things. And it also keeps you more engaged in life. So it's also correlated with an increased risk for dementia, people who don't hear as well. So getting your hearing checked annually is very important as well. All right, footwear, hot topic. So ditch the flip-flops, we already said it. But the best advice for footwear is supportive, well-fitting, low-heeled, non-slip shoes, especially if you have sensory problems in your feet. If you have neuropathy, if you have diabetes and you're not even sure if you have neuropathy, we want something on the back of your heel. We want something that's not going to slip on the ground or slip off of your foot. We want adequate space both for your heel and your toes, but especially your toes if you have sensory problems. Some sort of secure fastening that's not going to come undone, and proper fit. I've seen some patients with shoes that are way too big. And also, there are some shoes that they're designing these days that have a much larger middle part of the toe box. And I've seen people trip over the inside of their foot. So make sure that the shoes you're wearing, you're able to walk in comfortably. They're not too big and you're not tripping over your own feet.
Yeah, I saw this. Somebody, I really like Hoka's because they fit really well. But Hoka also makes a running shoe that has a part of the sole coming out of the back. And a friend of mine was wearing those going down some steps and actually hit the steps with that back of that shoe. So
Yeah.
be sure when you're purchasing shoes, figure out what your purpose is and make sure it fits that purpose as well.
Mhm.
So hydration, 8 glasses a day. One of the things that as we age, our sense of thirst diminishes. So even when your body needs replenishment, you might not realize it. With this cold, it's been driving me crazy because I've been trying to hydrate, and it's just really driving me crazy because I drink a lot of liquid anyway, and I'm really trying to push it. But persistent dehydration can be really dangerous. And we live in the high mountain desert, so you can get dehydrated very quickly, lead to difficulty in walking, confusion, rapid heart rate, or other severe symptoms that can land you in the hospital. Now, it doesn't mean you have to drink water. I mean, mix it up. They're great herbal iced teas. I have a mint flavored iced tea that I'm drinking right now. I have a great electrolyte recipe that'll be in the blog that includes these wonderful syrups that give flavor to the water, don't really add any calories, and they're really good for you. But make it an all-day program. So, steady assessments, these are the assessments that we do in September at CHRISTUS St. Vincent's. And these assessments help healthcare providers determine your risk of falls and recommend interventions such as exercise, home safety modifications, and medical adjustments. So we're going to take the 30-second stair challenge. So let me tell you what that is. And then I will start the timer and Katie will demonstrate after I tell you what's going on. She's going to demonstrate, then I'll start the timer. You're welcome to join this, but one thing you want to do is be in a chair, no wheels, so it doesn't roll back. And this is to test your leg strength and endurance. A chair with a straight back without armrests. Armrests are okay, just don't use them. And I will be the stopwatch. You're going to sit in the middle of the chair, place your hands on opposite shoulders, cross to the wrists, and keep your feet flat on the floor. Keep your back straight, your arms against your chest, and when I say go, you're going to sit, you're going to stand and then sit back down for 30 seconds. So let me grab my phone.
And while you do this, make sure you count how many times you stand up and sit down, because that's how we're going to compare you to other individuals your age and gender.
All right. I'm going to say 5, 4, 3, 2, 1, start. We're at 15 seconds. 5, 4, 3, 2, 1, stop. All right. So what this is You're going to you take the number of your times to a full standing position. If you're halfway up, count that as one. And then on the right, you're going to see a metric over there with your age and gender. And so if you're with your age, if you're 60 to 64, men should be doing 14 or more, women 12 or more. And what this says is your risk of falling is generally lower if you have a higher score. This test will actually be in the blog where you can download it. And if you start an exercise program or you're in the midst of an exercise program, maybe the first of the month, take this test, write your score down. 30 days later, take it again. See if you've improved, because that's what exercise and balance classes will do. It'll reduce your risk of falls. And what to do if you have fallen. Have you fallen in the last 12 months? Were you injured? Are you afraid this will happen again? Have this discussion with your healthcare provider. You may have this STEADI risk assessment that you just took that you can take in and say, looks like I'm at a higher risk. Can we talk about my medication? I'm getting a vision test. I'm getting a hearing test, or I've had one. And then you can have that information together to talk about with your healthcare provider. If you're not exercising regularly, it's unlikely that you could change the mechanics of how you fall while you're falling. Falling is like a car accident. It just happens. Very rarely do you get any advance notice that you're going down. But there are several things individuals with higher levels of fitness can do to minimize injury during fall. And that would be you stay loose and bent. It's like when we were younger, we were skiing, and the ski instructor said, look, if you're going down, don't fight it, just go on down. I don't care if you lose your equipment, just fall and keep going down with the fall. Our main thing we want to tell you here is try to tuck your head and look away from where you're falling. So turn and tuck. Land on the meat. That means your butt, okay? Distribute the force and keep falling. If you tense up and try to prevent your fall, you're probably going to do more damage than not.
So let's talk about traumatic brain injuries. One more slide forward, please, Anne. It jumped back somehow. There, ooh, touchy. Stand by. There we go. One more forward and we should be good. Wow, it really doesn't like that slide, does it? That's okay. We could talk about TBI from here. Okay. So traumatic brain injury means you've had a violent blow or jolt to the head or the body. So if you've hit your head or if you've really jolted yourself like a car accident, big fender bender or a real collision, and you think that your head was involved, it's really important to seek medical attention, even if you don't feel any different right away. And we're going to talk about why that is in the next slide here. So there are a lot of symptoms related to concussion or brain injury. Concussion is basically a mild brain injury that may or may not show up in testing, that may not come on for up to 2 weeks after a head injury. So if you've fallen and you've hit your head, go to the hospital. They will probably do a CT scan. That's the standard for looking for blood resulting from a brain injury that increases pressure to your nerves in your brain. But for 2 weeks after that, you need to be monitoring yourself for the following symptoms: headache, head pressure. If you've had a loss of consciousness, that's a really good reason to get your head checked out. Confusion or being in a fog, amnesia around the event, dizziness, seeing stars, ringing in the ears, nausea or vomiting, slurred speech, delayed response to questions, being in a daze or being fatigued. And the most challenging thing is when you're experiencing these symptoms, you may not be the one to recognize them. So if you've hit your head, it's so important that you tell a family member or a friend to check in on you periodically and see if they're noticing anything funny. One of the most common symptoms of a brain injury to the front of the head is sort of loss of reality. You don't see things as others see things. So that's when it's so important to rely on your friends and family to help you with this.
Right. I mean, we really do want to say that at that point, you may not be the responsible adult in the room. So
Mm-hmm.
be sure to have somebody aware of if you've fallen, if you've hit your head, if you've lost consciousness. You may be appearing dazed, but you do not know that. So it's super important. The wonderful thing about it is you can call 911. These are wonderful people who are there to help. That is their job. So, and they will do a quick evaluation and tell you their recommendation, whether you should go to the hospital or not. Again, that's up to you. But again, the only way to um, diagnose a brain injury is through medical testing at the hospital. So the importance of exercise, strength and balance training is one of the most effective ways to prevent falls. It's from the CDC. There's really no pill. There's no big $30 million center. You might go to the gym, that's fine. But basically, it's just really important to exercise to prevent falls. And that doesn't mean doing burpees or heavy weights or anything like that. It is really movement, consistent movement, and we'll talk about the different types of movement. There are barriers to exercise, but with things being online now, you can exercise from home. You can exercise at a local gym. So many of us with on Medicare have access to free gym memberships, where you can not have to pay for classes, for swimming, for exercising at a gym. And it's very important to create a daily exercise routine. So ways to be active, endurance. So try to build up to 30 minutes of activity that makes you breathe hard on most days of the week. The CDC recommends 150 minutes a week of exercise. Flexibility. Oh gosh, every day that I don't do flexibility, I know I feel it the next day. Um, I went to PT before and after my surgery. I think I could stay at PT all my life, Katie. I think that, I love my physical therapist, and but they don't want to see me all the time. So join a gentle yoga or stretch class and just make it your habit. Again, AARP offers classes. We do classes every Monday for AARP. You can rebuild muscle, and it's really great. And exercise builds muscles, and even though we age, we lose it, but it can be regained. Balance, just simple exercises. It's amazing just doing maybe 5 minutes twice a day in exercise can really improve your balance over 30 days. Home safety. When people talk about preventing falls, it's clear the clutter, light it up, hold the rails, cut the skids, and toss the throw rugs. Pardon me, this is really hard. I'm really sorry, everyone. Gadgets for personal safety. Katie, could you take that over for a minute?
Yeah, I gotcha. Yep. Okay. So we're talking about lights being super important at night. and also where there's a contrast in the flooring. So Anne's got some great pictures here. On the left, you'll see her stair entry into her house from her garage. She's got a light on the side of the edge of the steps so she can see the steps and really see where the edge is. And all of these can be purchased on Amazon pretty cheaply. The ones on the bottom left are little push lights, and or those might be motion activated lights. Um, you can have either, but they have little adhesive on the back so you can stick them on each of your stairs so that you can really see where the edge of the step is. In that center picture, there's discussed or shows a bed light that is activated when you step out of bed. So it's a strip that goes underneath your bed, and as soon as your foot touches the floor, the light comes on. It's not so bright that you're going to be wide awake, but it's plenty bright enough to see if there's anything around the floor that you might trip on, and good enough for you to take a few steps away from the bed. And then in terms of other things that might just make you a little bit safer out in the community, trekking poles are a great option if you don't want to use a cane or a walker. Two hands actually make you walk a little more naturally. So that's one great benefit of the trekking poles. They can be folded up really small so you can cart them around with you. You can buy rubber tips for the bottom if you're going to use them inside, or you've got the metal points on the bottom if you're going to be on uneven ground or gravel, which we have plenty of here in New Mexico. So lots and lots of options to make you safer as you're moving around. And again, stuff like this doesn't make you more dependent. It allows you to continue to stay independent.
So one of the things I'm really keen about is I do live alone, and people ask me about, what happens if I fall? Should I get one of those devices to wear around your neck? And I'm like, well, that could be, you could do that. But what we find is so many times that people just leave it in the nightstand that, they fall outside and you ask them where was your emergency device? It's in my nightstand. So I use an Apple Watch, and this is an example of the Apple Watch. It has fall detection, which uses accelerometers, gyroscopes, and AI algorithms to detect sudden and hard impacts followed by immobile. I'm sorry, I can't even talk today. Anyway, it alerts the emergency contacts and services. So what happens if you fall and the fall detection is activated? You get this message on the right-hand side. Looks like you've taken a hard fall. SOS call, I'm okay. Now, if you say I'm okay, everything goes away. If you do not respond, so you don't have to respond if you've fallen, it will call 911. It'll also call everyone that is on your emergency contacts in your iPhone. Now, you do have to have an iPhone. I get that. Samsung Watch, Galaxy Watch 7 and other devices are available as well. So,
I gotcha. What to do if you do fall. So, if you have a fall, it's really important to stay calm, especially if you're not injured. Take a minute to assess yourself for injury. If you're like, I think I'm fine, people love to run up and try to rush you up to standing. Don't let them do that. They're very likely to hurt you further if you are hurt. But check your body for injuries. See if there's blood anywhere. Think about, did I hit my head? Did I lose consciousness? Does anything hurt? If you break a bone, you're going to notice pretty quickly, right? And then you definitely don't want a stranger to try to pick you up off the ground. So if any injuries are evident after a fall, it's really important to call a professional, 911. They're trained to get you off the ground. They have specialized equipment to minimize pain to help you up off the ground, and then make recommendations about whether or not you need to go to the hospital. One thing that one of our local EMT providers mentioned at a talk we were doing in a rural community in New Mexico was that they're going to do a medication review with you to include, are you on blood thinners? Because if you did hit your head and you're on blood thinners, you're at a much higher risk for developing a subdural hematoma, which is the blood in the brain that causes pressure on your brain. So, don't let a layperson tell you what to do if you've had a fall. If you think you're injured or you lost consciousness or hit your head, it's really important to call 911.
yeah, it was really great when the local EMTs were talking about that because they were all neighbors with each other, like, oh, I don't want to call you at 1 o'clock in the morning. Like, that's our job. That's what we do. please call us. We don't want you on the floor, and we don't want you also, if you have a brain injury, the faster you can get treatment, the better it is.
That's right. And falls are the number one call that EMTs respond to, especially in rural communities. So you're not alone. Don't be embarrassed. Don't feel like you're bothering them. That is what they do.
Well, I was actually speaking with Geronimo Griego the other day before I left town, and he's the fire marshal of Santa Fe. And I asked him, I said, well, what's the ratio of your calls? And he's like, I don't have the numbers right in front of me. I said, well, let's say in 1 week you send out EMTs, you send out fire trucks. What's the more majority? Well, probably 80% is EMTs. And I said, well, and what percentage of that is falls? He said, probably 80%. So really, it is a very um, active group. Both the county and the city here have mobile integrated health units that are specifically designed to help.
Yep, and even if you can't get off the ground, if you think you're totally fine and you just can't get off the ground, that's why it's so important to have a way to call for help. This is something that I hound all of my patients and my mother about because if you fall and you can't get up and you don't have a phone, you don't have your Apple Watch or your smartwatch or your, whatever sort of emergency device you have, I've had patients that are on the ground for 48 hours with no way to call for help. Even if they're uninjured, they just can't get up. So even if you just need help getting up from a fall, that's what EMTs are there for.
Right. So we would love for you, if you're not joining our programs, we do have a free wellness pass where you can have 5 free classes a month. You're welcome to join us with that. We also, coming up on Tuesday, June 2nd, we have a different program called, um, I'm really it's getting a little nippy with me, isn't it? Come on. No, it's not going to do it. Mm.
There it is.
Yay. Success. Anyway, so stay tuned. This information again will be on our website in our blog, so you can review this or download a lot of this information. And also, thank you for participating. But we're opening up to Q&A right now. If you have some questions for us, please go ahead and unmute yourself, and we'll be happy to hear from you. If you want to raise your hands, great. Katie, I'm really looking now at fall prevention more. I think of it more like your car maintenance.
Yeah, it is. In
Yes,
fact, I tell patients, yeah, I'm sorry, go ahead.
yeah, well, you don't really want to go sit in the dealer every 6 months to get your oil changed for an hour and a half, but you do it anyway, right?
Hmm.
Because it's an investment in your car.
Yeah,
So we feel
yeah.
like, your fall prevention is really an investment in your overall health. Get a tune-up
And
every.
I literally call it a tune-up. When I have patients who just need a little sprucing up with their balance, their strength, I call it a tune-up. I'm like, you came to the right place. We'll get you tuned up.
Let's get a tune-up. I'm going to add that to everything. I really like car maintenance or body maintenance. I think actually the body maintenance is a lot more fun.
Yeah, way more fun.
Yeah. Thank you, everybody. We appreciate your being here again. We'll be up online tomorrow. All right, I'm going to sign off. Thank you, everybody.
Take care.